Welcome back. A record number of Americans are expected to sign up for health care plans under the Affordable Care Act during open enrollment that ends January 16th. As of today, more than 15 million people have so far enrolled in plans through healthcare.gov. That, by the way, is a 33% increase from the amount of people who opted into plans at this time last year. Federal health officials expect more than 19 million people to obtain health coverage by the end of enrollment, again on January 16th. Victoria Knight joins us now with more on this. She's a healthcare policy reporter for Axios. Thanks for being with us, Victoria.
Thank you so much for having me.
So we're kind of rolling through those stats. There are more people than ever now signing up for healthcare plans under the Affordable Care Act. I wonder why.
Well, in one single day in December, we had the highest number of signups ever, and there are a couple of reasons for that. First off is that during COVID, there were several pandemic era protections in place that made sure people could not be dropped from Medicaid rolls. And now those protections are being rolled back. And that means that instead people may be signing up for ACA plans. Another reason is that in 2021, under President Biden, Congress passed a law that expanded subsidies for people. So that means some people who previously couldn't get an ACA plan for an affordable price can now do that. As HHS likes to say, some people can sign up for a plan for $10. So that means more people are signing up for plans. Those subsidies go through 2025. And then a third reason is that under the Biden administration, they really expanded how much they were marketing these plans. And that was something the Trump administration did not do.
Okay, that makes a lot of sense. And speaking of Trump, he says, he's looking at alternatives to Obamacare should he win the 2024 election. So, what could this mean for people who already signed up?
Yeah, that's a great question. I think there's a lot that we don't know. So, one important thing to remember is that President Trump, during the 2020 presidential campaign, repeatedly said he would produce an alternative healthcare plan. And so far, we have never seen that plan. So, it's hard to say without knowing what that plan looks like. And there's also another thing. It would have to pass the two chambers of Congress. And we also do not know what the makeup of those two chambers will be, who will be in the majority. So if it's another split chamber of Congress like we have right now, then there's no chance that repeal and replace would happen. Now, if it's a Republican majority in both chambers, maybe it's possible that that's something that could happen. But for the meantime, it's hard to say what would happen without knowing what President Trump's healthcare plan looks like.
Right. A lot of unknowns right now. Victoria Knight, thanks so much for breaking that down for us. We appreciate it.
Thanks so much for having me.